My name is Johannes Snijders, and with me is a group of journalism students from the Tshwane University of Technology. Our guest today is Professor Bavesh Kana, and he is leading the Biomimicry Diagnostic Verifications Control Team at the University of the Witwatersrand. They received the 2021 NSTF-South32 Innovation Award for a corporate organization. Good day, Professor, and thank you for joining us.
Good day. Thank you very much for having me.
Professor, before we go on, please provide us with a short background of how you became the leader of such an award-winning team.
So our journey really goes back about 10 years when South Africa made a policy decision to change the way we diagnose TB. At the time, we were really using very old and inefficient methods to diagnose TB. And the National Department of Health decided they were going to switch to what we call molecular diagnostics. These are more faster. And really at the time, the challenge they faced was, how does one, when you deploy these new diagnostic devices in the field, how does one actually know that these devices are fit for purpose and that they actually operating correctly in laboratory settings? And so they approached us and asked, can you develop control reagents for us that we can deploy in the field? And really, it was about 2011 where we started to use this biomimicry approach to create controls and verification material to allow laboratories to QC their TB diagnostic processes. And it's been a wonderful journey. We started with a few labs in South Africa in 2011, and by the end of 2012, we had done almost, I would say, every laboratory in the public healthcare setting in the country, and we were supporting TB testing programs in roughly 20 countries around the world. Around the same time, we had received endorsement from the World Health Organization and also endorsement from the Centers for Disease Control in the US, the CDC. They approved these controls and asked if these could be distributed globally. And so effectively, what started off as a very small and modest program became a global program to support TB diagnostics mostly in countries that are endemic for TB. And over the years, we've been able to repurpose that technology for a variety of different diseases to the point where we were actually able to also repurpose it for COVID. So that was our journey. It's been fantastic. It's fantastic to work with such a wonderful and gifted team.
Professor, in short, how did the research within your team contribute to the diagnostic of COVID-19 infections?
So when we think of diagnostics, right? We often think of the front end of diagnostics, right? So somebody goes, and let's think about COVID, right? You suspect that you have COVID, and you go down to a drive-in, you do a nasal swab, and the swab goes to the laboratory, and then within a day or two, you get the result on your cell phone. So most people see what we call the front end of diagnostics, right? But in order for that result to come on your phone, a lot of little processes need to occur in tandem in the back end, so the sample has to come to the laboratory and it has to be processed in a quality assured way, in a device that we know is fit for purpose, that that device actually works. And then when the result is obtained, we have to make sure that the result enters the laboratory management and information system and that you get the correct result. Your specimens aren't mixed up and the sample is processed correctly. And around, I would say April 2020, when, the COVID epidemic came to South Africa and we were faced with huge public health challenges, we heard a lot in the public space this issue of there aren't enough tests. And then we got to the point where we had tests to enable mass testing. And the real roadblock was that we needed this quality assurance material to enable laboratories to first check that their processes worked and that the tests were fit for purpose. And so this became one of the big stumbling blocks. We couldn't roll out mass testing because labs were faced with this challenge of having control material. Now, when we think of control material, what would you have? Coronavirus would be a good control material. But as we know, coronavirus is dangerous. It's not safe. And if we send coronavirus to labs, we're exposing lab staff to dangerous agents. And so we then stepped back and said, we had this biomimicry approach and it worked for TB. Can we actually create biomimetics that look like coronavirus, but are safe for labs to use for their QC process and their verification program. So that's effectively how we helped. We very rapidly pivoted our technology to create mass testing controls that were suitable for COVID diagnostics. And we sent these out through the National Health Laboratory Services, and that enabled the NHLS to very quickly roll out mass testing. And we're now supporting, I would say, roughly 30 countries, mostly in Africa, but in other places in the world, with their COVID mass testing programs.
Professor, and if we zoom to the NSTF-South32 Award, what does that award mean to you and then ultimately to the team that you are leading?
So, it's the NSTF Awards are, as we know, they're the Oscars of science. So it's incredibly wonderful to be nominated and finalized for the award, but it's also very, very wonderful to receive this award. We're very humbled by the fact that we were selected as the winning team. I'm humbled because, there have been so many people who came out with heroic efforts. If we think about frontline healthcare workers, if we think about the doctors in ICUs, if we think about the people who are taking swabs, there are so many heroes in the country today that have made meaningful contributions to COVID at risk to their own health. For us to be selected, we're deeply humbled. It's also wonderful for the team to get the recognition. Honestly, when COVID came, we were faced with a challenge that we'd never been faced with before. We had to develop all these controls at what I would like to call warp speed, at super high speed, and all the borders were closed and we couldn't get reagents. And my lab staff was sleeping here in the lab. They were working late nights. They were working in the weekends. Yeah, it's just wonderful to be able to have this kind of acknowledgement for all of their efforts.
Professor, and then if we can move to you being a researcher, what is that one fact that every South African should know?
So I think that every South African should know and be proud of the fact that what we've done is a homegrown South African biomedical intervention. We've actually produced this here in South Africa, and it's been done with South African resources. It's been done largely through the support of lots of local partners. And today, as a country, we're able to offer this beacon of hope to many countries around the world. We're able to step in and help them to quality assurance in their mass testing programs. We're able to ensure that citizens in other countries and in South Africa are able to have confidence in their COVID diagnosis when they receive it. This is the right diagnosis. It's not been mixed up with somebody else's. The diagnostic test has been done correctly. I think every South African should know this. It's coming from South Africa. It's helping South Africa. It's going to so many places around the world. And it's really something for all South Africans to be proud of.
To conclude, what can we expect from the Biomimicry Diagnostic Verification Control Team within the following 2 to 3 years?
So as you know, one of the challenges that we faced even with COVID is the rapid emergence of new coronavirus variants. These new variants are threatening to cause new waves of infection. They're threatening to undermine the effect that vaccines have in terms of protection, but they also have a significant threat to the integrity of diagnostics and diagnostic delivery, right? If some of the mutations in these new variants occur in places that are targeted by diagnostic tests, the accuracy of diagnostic tests can be compromised. And so one of the things that our team is focusing on very intensely over the next year or so is to very rapidly create coronavirus biomimetics that mimic all of the different variants. We've been successful so far with the beta variant. We've now done the Delta variant, and we're looking at other new and emerging variants. In addition, COVID and the repurposing of a lot of public health resources towards COVID has undermined some other programs, such as the TB program and the HIV program. And so we anticipate that there's going to be a need for intensified diagnostic delivery in those two programs. So we also focused a lot in the last 6 months or so, and this is going to be a focus going forward, on the development of biomimetics for drug-resistant TB, and also to enhance our biomimetics suite of products for HIV.
Professor, thank you so much for your time. This was Professor Bavesh Kana, and he is leading the Biomimicry Diagnostic Verifications Control Team at the University of the Witwatersrand. They received the 2021 NSDF-South32 Innovation Award for a corporate organization.